Hello guys, welcome back to my channel, which is Real Homeopathy, and today I'll be explaining about the pelvic inflammations or the infection which we cause precisely in gynecology. It is the most important cause here. So as we begin this class, I would like you all to like, share and subscribe to my channel, which is Real Homeopathy. Today we will see about the pelvic infection. Pelvic infection which is caused by certain microorganisms or the bacteria or viruses, and these are the causes, and there are certain organisms which causes mainly to this pelvic area, and it is called as pelvic infections. So the causative organisms of this, there are pyogenic cause, sexually transmitted disease, parasite, fungal, viral and tubercular. Firstly, we will see about the pyogenic, which is 50% in all of us in the causative factor. This is the most common type. Okay, this is the most common type here, and the organisms responsible here are aerobes and anaerobes. So in aerobes you will see it is a gram positive organisms are which are like staphylococcus, Klebsiella, then gonorrhea, etc. But in anaerobes, these are also gram positives which are anaerobic streptococcus precisely. Okay, which is streptococcus and clostridium, C. tetani, etc. Here you will see in aerobes you will see Klebsiella, Pseudomonas and gonorrhea, etc. And in anaerobes you will see like viruses which are Streptococcus, Clostridium and C. tetani, etc. So the gram negatives are mainly bacteroids. Okay, next we will see sexually transmitted disease. The organisms here causing are the N. gonorrhoeae, okay, Chlamydia, Trachomatis and Treponema palladium, herpes simplex virus type 2, human papilloma virus, so which is N. gonorrhoeae, Chlamydia, Treponema palladium, herpes simplex virus type 2, human papilloma virus, Haemophilus. All of this we'll see there is a Haemophilus. Next we will see the third one will be like a parasitic cause. So in parasitic you will see Trichomonas vaginalis, and in fungal you will see Candida. Okay, and viral you will see herpes simplex virus type 2, human papilloma virus. Okay, which is HIV virus again, a condylomata, herpes simplex, human papilloma virus, HIV virus, and then condylomata, accumulata, etc. So these are all the viral causes. In fungal you will see Candida albicans, parasitic Trichomonas vaginalis. Next one you will see tubercular causes. So tubercular bacteria organisms here are Mycobacterium tuberculosis. So this is a causative organism here, which is a causative organism. Okay, so in tubercular you have seen this. Next, coming to the modes of spread of infection. Okay, how do the virus spread? So which is the mode of transmission of that thing? So what is the mode of transmission of that organism? So firstly we'll see through continuity and contiguity. So first one, this is all about the causative organisms, and next coming to modes of spread of infection. So coming here is through continuity and contiguity. Gonococcal infection. So certain bacteria and certain organisms are there with a transfer which move along from lymphatic channels and through veins and through circulations and also through blood streams, and it is also like that. So here you see through continuity and contiguity is the first one, which is a gonococcal infection, and secondly you will see through lymphatics and pelvic veins. Okay, which is a post-abortal and puerperal infections. Okay, which is a biogenic organisms other than like gonococcus. Third one you will see that is through bloodstream, and which is a tubercula. And fourth one we will see from adjacent infected areas or organs. Okay, so these are the modes of spread of infection, which are four types: to continuity and contiguity, lymphatics and pelvic veins, bloodstream, and through extragenital organs, adjacent infections to the organs. So this is the cause. Okay, next we will see about the main part of this today's class, which is acute pelvic infection. So in acute pelvic infection, firstly you will see pelvic inflammatory disease, which is PID, and secondly following delivery and abortion you will see certain infections which are acute, which are sudden in a time. The next one following the third one is following gynecological procedures. Certain times there are certain gynecological procedures, you will be having certain infections contaminating at that time. Fourth one will be following intrauterine devices, and fifth one will be secondary to other infections such as like appendicitis. Okay, secondary to other infections which is like appendicitis. So these are the five infection causes here. First one we will go through here is like pelvic inflammatory disease, which is a PID, and they'll be asking this for 5 marks, which is a must know question, and even they'll be asking this for 3 marks. And which or what all you have to write when they ask for 5 or 3 marks is, so you have to write a definition, you have to write the risk factors of that, and also the clinical features, if possible, modes of transmissions, signs, and its investigations. Okay, so firstly we will see, so definition of this, so infection of upper genital tract. Okay, which is a spectrum, it is a spectrum of infection, it is a spectrum of infection and inflammatory. Okay, which is typically typically involving the uterus. So there are genital organs which are usually involved here. So first one we will see the involvement of that is in the uterus, which is a endometrium. Okay, and then fallopian tubes, ovaries, pelvic peritoneum, and surrounding structures, which it is also called as parametrium. So it is attributed to the sending spread of microorganisms from the cervico-vaginal canal. Okay, the clinical syndrome, it is not related to pregnancy and surgery. It is not related. The terminology is currently used to express the specific organ pathology. This infection may include any or all of the following anatomic sites, such as causes like endometritis, terminology such as we use as examples in cases of endometritis. Next, salpingitis, pelvic peritonitis, tubo-ovarian abscess, or parametritis. Okay, cervicitis, it is not included in this list. Cervicitis not included. So pelvic inflammatory disease is a major problem to the reproductive health of young women. So it may be asymptomatic or it may be subclinical. Okay, so risk factors for this are menstruation teenagers. In menstruating teenagers, it is very easy to occur, and even in multiple sexual partners, and absence of contraceptive pill use. Okay, previous history of acute PID, intrauterine users, If any person has got a history of this acute PID, then again there is a chance of reoccurrence. And in intrauterine device users and even in low socioeconomic status, okay, in those people also it is very prone to happen. Next you will see husband or sexual partner with infection like urethritis or sexually transmitted infections. So these are the risk factors here. Precisely, you will see these are the main risk factors. So if it is there, then there is a chance of recurrence of this acute pelvic infection. So next, coming to clinical features, you'll see in clinical features there are symptoms and signs. So which you need to mention. So in symptoms, you will see it is a bilateral lower abdominal and pelvic pain. Pain will be there. So there is fever, lassitude and headache. So pain is dull in nature. Next, coming to irregular and excessive vaginal bleeding. It is usually due to association with endometritis. Okay, there is nausea, vomiting, abnormal vaginal discharge, dyspareunia, which is a painful sexual act. Next, you'll see there is a pain and discomfort in right hypochondrium due to concomitant perihepatitis. It is also called as Fitz-Curtis syndrome, which occurs in 5 to 10% of cases of acute salpingitis. The liver is also involved. Next, coming to signs. In signs, you'll see the temperature is elevated, which is to 38.8 degrees Celsius. There is abdominal palpation. It reveals tenderness on quadrants of lower abdomen. Tenderness in the quadrants of the lower abdomen. The liver may be enlarged and tender, which is also called as perihepatitis. On vaginal examination, you may see it reveals there is a vaginal discharge which is abnormal. So here you see liver is enlarged. Okay. Vaginal examination reveals abnormal discharge which is even purulent in nature and congested external urethral meatus. Or openings of Bartholin ducts. Okay. Thirdly, you will see there is an examination which is a speculum examination. Speculum examination, it reveals or it shows congestion of the cervix. So, congestion of the cervix with discharge. Okay. Next, on bimanual examination, it reveals bilateral tenderness on fornix palpation. This is all about the signs and symptoms, which is a clinical features. You need to write. Even they will be asking only clinical features and cause for 5 marks or for 3 marks, which is a must to write. Investigations for this is identification of organism, collection of pus, cervical canal you have to check for that, and if necessary laparoscopy is needed and sonography. Okay, differential diagnosis you will see which is appendicitis or disturbed ectopic pregnancy, torsion of ovarian pedicle, endometriosis, diverticulitis, urinary tract infection. So this is all about the differential diagnosis here. If you leave, the patient may go into certain complications. So dyspareunia or infertility, it may go to chronic chronic pelvic inflammation. So we will see what is chronic pelvic infection here. So it was acute, which where you'll see suddenly, but in this chronic it takes a lot of time. So infection is a distressing clinical entity which follows acute infection, acute pelvic infection Hmm? Following low grade recurrent infection and tubercular infection. So these are the three infections which can be due to reason of this chronic pelvic infections. So as it takes a lot of time to develop, and certain persons or certain patients may even be symptomatic to this infection. So the clinical features, the entity may remain asymptomatic. There may be previous history of acute pelvic infection, and symptoms you will see is chronic pelvic pain of varying magnitude, and pain aggravates prior to menstruation, which is due to congestions. And also you'll see painful sexual act, which is dyspareunia, which may be due to deep and may be located unilaterally or it is located bilaterally. Nextly, you will see congestive dysmenorrhea, painful congestion menses, and lower abdominal pain. Next is menorrhagia or polymenorrhagia, which is again due to congestion. And you will see vaginal discharge, infertility. So here again one important factor for infertility we will see. We need to know the cause, important factors for infertility. First one is cornual block. If there is any cornual block, then you will see infertility. Then loss of cilia, and next we will see loss of peristalsis due to thickening of this tubal wall, which is due to the movement. There is less movement. And closure of abdominal, thickening of tubal wall. And next we'll see closure of the abdominal ostium and distortion of the tube due to peritubal adhesions. Okay, on examination you have to examine the abdomen for tenderness, and also okay for that, and even for pelvic examination also you have to do vaginal examination. Investigations will be like investigations following blood examination. Investigations have to be like blood examination for evidence of leukocytosis, and hemoglobin estimation, leukocytosis and hemoglobin estimation, and ESR, which is a erythrocyte sedimentation rate. So these three are investigations. And you have to even do urine examination. In urine examination you have to do the routine examination, and if it is necessary then you have to do the urine culture. Then the other investigation is laparoscopy. Okay, this is helpful to confirm the diagnosis and to know what is the extent of lesions. This is all about the investigations today, and I'll be just ending the class with this much, which is acute and chronic pelvic infections. And precisely we have seen the pelvic infection chapter, and still I have to explain you in detail about the infection of the pelvic, and which in acute they will be asking this more for 5 marks, chronic they will be asking for 3 marks, and they will be asking this pelvic inflammatory disease for 10 marks, like definition, its cause, its pathogenesis, its clinical features, and its investigations, also management, how you will manage the case. So that is all about today's class, and I would like all of you to stay tuned for more updates, and I want to thank you.